Thank you very much, and thank you to Mark for asking me to talk. When Mark gave me my title, which will appear shortly, Paediatric Care Beyond the Comfort Zone, I was quite perplexed by it, and everything I came up with didn't sit comfortably, so I did have to ask for some advice. But I am a paediatric radiographer. I work between a children's hospital and a radiotherapy department, and I am the liaison between the children, the families, and the multi-professionals when it comes to radiotherapy. And often, unfortunately, radiotherapy has sometimes a negative perception for families, and when they hear that their child's got to have radiotherapy, even though they've had chemotherapy and possibly surgery or just surgery, radiotherapy sometimes comes with that feeling of dread. So hopefully, as I go through this presentation, we'll alleviate the dread a little bit. Okay, or not. So Yen went through this morning what radiotherapy is, but just to recap, it's a highly accurate treatment that uses high-energy X-rays to destroy cancer cells in a specific area, unlike chemotherapy, which goes systemically through the body. And when do we use it? Usually used in conjunction with surgery and or chemotherapy, but it can also be used by itself when the other modalities aren't possible. So why do we use it? We use it to destroy cancer cells in a local area, which, as I've just said, is different to chemotherapy, which is systemic and travels around the body to destroy cancer cells. And it often feels to families, or we get the perception from our families, that radiotherapy is the most daunting treatment that their child's going to undergo. Now, why is that? Now, I think it's probably because we're asking you to go to a new hospital, meet a new team with new surroundings, a completely new routine, and a lot of new information. Why do I ask you to go to a different hospital? Well, unfortunately, radiotherapy departments are specialised, centralised expert care. The equipment is expensive. One machine's probably in order of £1.5 million, and most centres will have multiple machines. They need a lot of maintenance. There's a lot of people behind the scenes who make those machines work every day. But hopefully we're getting it right, and these departments, even though they are adult orientated, hopefully they are child-friendly facilities. And generally you are coming to us as an outpatient rather than having an inpatient stay. So hopefully you're coming from home. That's a radiotherapy machine. That's what they look like. So it's a massive machine, hopefully in a room that's quite spacious, light and airy. But, that is quite daunting. To ask a child to walk into that room and see such a phenomenal alien, we've got some work to do to get them in there. So who are the team? Why have you got to meet these different people? And I just thought I'd put it as an umbrella because actually we all are part of the paediatric oncology team, even though we work across a different site. You might meet an anaesthetist or the anaesthetics team if your child needs to go to sleep for their treatment, depending on their age and how compliant they are. Hopefully you'll meet a paediatric radiographer like myself who will work with you and support you through your journey. Clearly the most important people are the clinical oncologists because they do all the consenting and the planning, and they're the people that make everything happen. But place specialists are really important in our role. As I've just shown you that picture of that machine, it's huge, it's very daunting. Your child's got to stay in that room by themselves. So we work very closely with place specialists to work with coping strategies and distraction strategies to hopefully get them through their treatment. And also the radiotherapy team, that's massive. That's your radiographers, physicists behind the scene. Hello. And you've got people in the mould room who help us make our special moulds. Like we saw Millie's earlier on, we use those in this country as well. But we all work as part of the paediatric oncology team, and part of my role alongside the clinical oncologist is to make sure that that team works. So we attend their multidisciplinary meetings. They look to us for support as well as we give them support for the families. So what happens? You're told your child's got to have radiotherapy, you're consented for that process, and then there comes a whole scheme of preparation. And as I've said, we work extremely closely with the play therapists to make sure that preparation is done properly, timely, and actually that we all agree that that child is going to manage to have their treatment and they are going to manage being in the room by themselves and that, you know, they're going to cooperate and comply with the treatments, because once you've started your radiotherapy, you don't really want to have to change tack. You might have an appointment in the mould room, which will be to make a mould like we saw for Millie earlier. Again, you want to make sure that that mould is going to be accurate and used every day for their treatment, so you want that to be a successful outcome. They then have a CT scan. Now you might ask, why do you have to have another CT scan? Our children have had loads before. But in radiotherapy, we use lasers to make sure that the children get into the right position every day. So we want to CT them in their treatment position, and then as Yen showed earlier, we use their MRI scans, their diagnostic scans, with their CT scans to plan the treatment. Tattoos, the bane of our lives. Tattoos are used for children who don't have a mould made. They are, as it says on the tin, they are a tattoo using Indian ink and a needle. Often children, by the time they come to us, are needle phobic, don't want to have their tattoos done, but generally we do get around them and they do have them, and then we draw butterflies and things around them to make them nice. But they are the bane of our lives. So behind the scenes you might ask, well, okay, we've had all our preparation done, why is it going to take 2 weeks for us to start? So behind the scenes, a lot of preparation goes into actually developing the treatment plan to make sure that we're optimising the area that we want to treat whilst hopefully minimising the dose of the normal tissues. And lots of checks are in place before the first treatment. So it does take a lot of time, and often clinical oncologists will come back and look at the plan that's been generated and they want it tweaked a little bit to make sure that, you know, we really are getting the optimum treatment for the child. So then treatment happens, usually once a day, although there are some treatments where children come twice a day, but usually once a day, Monday to Friday. We do let you have your weekends off for good behaviour, and usually for about 6 weeks. Now, 6 weeks at the beginning seems really daunting, a long time. Why have I got to come for that long? But as Jen said earlier today, because we give a little bit each day, that's why you have to come for a number of weeks. If we gave you that end dose all in one go, it could potentially be catastrophic. Treatment actually doesn't take very long. With technology changing, things are getting, maybe treatment does take a little bit longer because of the way we're delivering treatment. But actually, hopefully, if a child's not having an anaesthetic, you're probably in and out within half an hour of the department. If they're having an anaesthetic, obviously that you've got the anaesthetic time beforehand and then the recovery time. Children do have to be in the room by themselves, so, you know, we do need to make sure that they're going to keep still, they're not going to try and get off the bed. As you saw in the photograph, the bed does move up and it does move underneath the machine. So we have to be sure that they're going to be okay in the room by themselves. And, you know, if they need to have an anaesthetic, then they'll have an anaesthetic. But with play, quite often we can educate the children well enough so that, and we can put other things in place to help them. So, for example, a child can hold one end of a very long ribbon on the bed, and the parents outside can have the other end, and they can be talking to them over the intercom. So they actually know that there's somebody out there, not just left them in a, you know, in a dark room with a massive machine in there. And distraction, there's lots of things that we can do with distraction, and we do work, as I said, really closely with the play specialist to make sure that distraction is the right thing to do. Give them things to focus on, whether it's, you know, you tell them to think about something special, or we count, or we have light shows on the ceiling so they've got something to look at. There's lots of things that we can do, and hopefully make it better for the children as well as the parents, because it is very difficult for everybody. Side effects is usually the reason why people are most daunted when they're told that their child's got to come and have radiotherapy. But with modern technology, the doses, the treatments that we're going through and the techniques that we're using, the side effects that can happen as late effects and the acute effects whilst they're on treatment, they are getting fewer than in past years. So it's not quite as bad as it seems. But the side effects do depend on a number of factors. And as we heard earlier, we don't like to irradiate the very young brain. And that's, you know, for the cognitive effects that can happen. But the age of the child, the area that's treated, the dose that we've given, and the other things that come into place, whether they've had surgery in that area, all add to the side effects that can happen. But as I said, with the modern technology that we've got now, and obviously we've heard about proton therapy, there are still side effects for that, but we are trying to make them less and less. And hopefully, as we've gone on, years have gone on, our supportive care mechanisms have got a lot better. So because our communication skills are better, we're working out with families, you know, what can we do to make this journey better for you? We're talking about blood products, we're talking about pain control, supportive nutrition. All of those things are hopefully making the side effects less while patients are on treatment and in their future. We've already heard about proton therapy, and I think paediatric care beyond the comfort zone, this certainly has put us as professionals out of our comfort zone. I never knew I was going to become a travel agent in this job, but I seem to be able to organise flights to Jacksonville and Oklahoma. I seem to know all about hotels in the region, all about where to go and eat, where to shop, where to buy your mobile phone, and I didn't know I was going to learn that. But, you know, it does benefit some children with particular tumours. We haven't got it yet, but it is coming. But it takes you guys as families and parents out of your comfort zone. It's definitely taken us as professionals out of ours. But we are here to support you. We do help, hopefully, to organise and liaise with the teams overseas. And hopefully we are that communication triangle again. So importantly, even though you've gone overseas, we're still here and we're still here to help you. So email and everything is phenomenal whilst you're over there, because if you've got questions and like your concerns with the side effects in your consultation, oh my God, we never thought we would be told that. You know, we have emails coming back to us, and now we've learnt so much. As more families have gone out, more of us have communicated what have we learnt from everybody's experiences. We're getting better and better at sending you out with more and more knowledge. So all in all, we do recognise that coming for radiotherapy is daunting. But we are here to support you, and certainly in my role, it's very much of a supportive role. I'm not a clinical radiographer anymore. I don't work on the machines. I do have all the time in the world for the families when they come. Sometimes they might not feel like that. You know, if you've got several families on, you've got to divide your time up. But, you know, I am there to support the families that I certainly see. We do try to make the departments child-friendly. And all the staff that work in departments, they are all experienced with children, even though the majority of our patients are adults. I haven't put too much in about it, but there is a good practice guide to paediatric radiotherapy, which is somewhere waiting to be published. But hopefully that will make sure that nationally we're all working to the same level, but also our principal treatment centres, they can actually know what they can expect from their radiotherapy team as well. Because, like I said, we don't work in the same department as the Children's Hospital. I'd love to work in that hospital, but I don't. It would save a lot of things. I'd have more access to everything. But actually, it's not practical at the moment. So we have to make the best situation of what we got. And I really do hope that the families that have been through it, who maybe found that it was going to be really daunting at the beginning, I hope it isn't as bad as you think, because I hope that the professionals that are helping you through it do help and guide you through. And I just wanted to share with you, there's animated film that we had put together, which is about 5 minutes long. The script is all taken through interviews that were done with children.
And how you help all.
And this is coming. The script was put together through all the interviews that 8 children were interviewed, and then the animators made the animations fit. And we use this with our children, and hopefully it will be going national within the next few months, because every department should be getting delivery of the animated films for the families. So I'll let this play.
Hi, I'm Jenny, and this is my gran. I'm going to show you around the radiotherapy centre and how you help all works. This is the best place to be if you got cancer, because this is where they mend you, and everyone here is a super helper.
Can I put it on your nose?
This is Yvonne.
My nose.
She's a play specialist, and playing is her job. Radiotherapy can fix the cancery bits in most parts of your body. But to make it work, you have to keep very, very, very still. Not you, Gran. This is quite hard, especially if you're a fidget. So, if you've got a tumour in your head, you get to make a one-of-a-kind superhero mask to keep your head still.
Here today, we're going to make you a mask.
This is Alan, the mould room technician. He helps you make your mask with a special magic mesh. Warm water makes the mesh go all soft and floppy.
And we then simply drape plastic.
After a few minutes keeping very still, you have your own special, one-of-a-kind mask.
Well done.
Yeah, and it's cool when the warm thing goes on your face and it feels nice. I make little tiny noises and that makes me not move. And
sometimes you don't need a superhero mask. If you've got a tumour in your tummy or in your bum, the radiographer uses a super sucky beanbag to make a comfy cushion that fits you like a glove. Every time you have treatment, you have to be in the exact same position. So the radiographer sometimes makes tinsy marks on you to help, like dilly tattoos. Not like you, Gran, put it away.
I had tattoos on my back. I didn't hurt, just tickled.
This is where you get to use your magic mask or sucky beanbag for the first time.
And we're going to get you led on our
This is a
treatment
CT
couch.
scanner and it takes pictures inside your
I don't know if
body.
you can see these lasers. You have to keep really, really
They
still.
talk to you and they say that they're going to leave the room and they're constantly telling you what's going to happen.
So while you're at home, lots and lots of clever oncologists and physicists look at the scan and plan and plot to make all the unhappy bits inside you happy again with a one-of-a-kind super special plan. And then your big day comes. It's time for your special plan to happen. You need an extra special machine to do it. A radiotherapy machine. It's really huge and costs more than a palace. And it's so super duper clever you wouldn't believe. And it's here just for you. That means you have to be alone for this bit. But don't worry, everyone can see you and even talk to you. They're just around the corner.
Are you ready, John?
Here we go! And that's it. Are you okay, John?
Well, I didn't feel anything.
But those naughty cancer cells did. Look. Looks like the super special plan's working. You've just got to keep zapping every day for a few weeks. And your very own oncologist is always there to make sure you feel okay.
I was a bit scared at first and I didn't care. And I fell off ice cream and I did not feel one thing.
It won't hurt, but just you're going to be tired afterwards and just rest.
You just lie still. It's just a bit boring.
Don't be scared, it's just a scan. Makes you better. This is the last day of my treatment. I just stay still for a minute and... There, all done. So, it's not as bad as you think, and it really is the best place to be if you have cancer. Just remember, you're one of a kind!
So hopefully that gives you a bit of an insight as to what we show the children. And also it makes the children hopefully feel special and they are one of a kind despite everything they've got to go through. So Thank you very much.